I'll just work on that.
Being coming from an accreditation background for last 20 years, running accreditation body.
Doesn't matter. You can play it later. Actually, it's okay, Rahul.
Standards can't do
All right,
magic
sir.
without implementation.
Yes, so we'll just fix the technical issue and we move back to this. Um, we we also have with us here today Dr. Sunil Pandya sir. Dr. Sunil Pandya sir is an eminent neurosurgeon and was the former head of the Department of Neurosurgery right here in KEM. He's also an avid historian and an expert on medical ethics, and is currently the chairperson of the Dr.M.V.L.Kothari Chair and Division of Medical Humanities. I would request him to say a few words before we begin. Thank you, sir.
Thank you, Rahul. The Humanities Division was formed a few years ago with the chief goal of getting our students and residents and our younger consultant colleagues interested in areas such as the history of medicine, medical ethics, literature, philosophy, and so on, which is sadly lacking in our curriculum today. I will not go into the details of the process by which this division of humanities has evolved, but I will tell you a few words about some of the key people who are behind most of the activities of this humanities division, and there have been many of them. The first and foremost is Dr. Lopa Mehta. She is the heart and soul of the medical humanities division. And she is the driving force behind almost all the activities that we have been privileged to carry out. She has as very able colleagues Dr. Padmaja Mawani and Dr. Swarupa Bhagwat, and of course our long-standing, very senior and respected colleague, Dr. Ravi Ramakantan. I would be failing in my duties if I was not to highlight the effort and the time which these individuals have put into all the activities, including the courses which are now being conducted and which are proposed for the future. One of the key beliefs, and as time has proven, a very correct belief of Dr. Lopa Mehta is that we are blessed with superb medical students. We probably have the cream of medical students in our institution. And she has always said that given the opportunity and given encouragement, they are capable of anything. And you will see this time in this particular series, the series on the history of medicine, that it has been organized by Dr. Rahul Kothari, whom you have just encountered, and his team. And you will see what a marvelous job they have done. We have a few more courses which are either current or past or in the future. And I will give you the names of just 3 of them because we feel that these are areas in which our medical students are not having the awareness that they should have. The first is the course on tribal health. I think this has already been completed. Then we have proposed for the future gender in health and another course on narrative medicine. Now, I don't wish to take time away from our principal speaker today, who is one of our most prominent intensive care specialists in the city and who is an excellent speaker. So without infringing on his time, I'm handing the microphone back to Rahul.
Thank you very much for your kind words, sir. So now, before we begin, I'd like to introduce our speaker, Dr. Jehangir Sorabjee, sir. Dr. Jehangir Sorabjee completed his MBBS and MD in internal medicine from Grant Medical College, following which he worked in various hospitals in London and obtained his MRCP and DTMH. On his return to India, he joined the Bombay Hospital as an honorary consultant physician and is currently an honorary professor and the head of Department of Medicine at the Bombay Institute of Medical Sciences. Dr. Sorabjee's main subspecialty is infectious diseases, and he has worked at the Kasturba Infectious Diseases Hospital and at the Hospital for Tropical Diseases in London. He is also the honorary physician to the Governor of Maharashtra and a former member of the Academic Council of the Maharashtra University of Health Sciences. He has numerous academic publications and has authored many textbook chapters. He was awarded an FRCP by the London College at the young age of 40 years. Dr. Sorabjee's interests and accomplishments extend way beyond medicine. He has published an acclaimed book of aerial pictures of Mumbai titled Above Bombay, images from which have been displayed in many international exhibitions. His photographs have also been displayed in the Art India magazine, Kala Ghoda Festival, and are on permanent display in the Mumbai airport. We're honored to have you as our speaker today, Dr. Sorabjee. Thank you so much for coming.
Can you hear me, everyone?
Yes, sir.
I'm audible. So Rahul, should I now share the screen?
Yes, sir.
Okay, let me see. I'm very good at that. So if I have to, host has disabled participant screen sharing.
Yes, sir. So you should be able to do it right now.
Okay, let's get on to that. Is my PowerPoint visible?
Yes, sir.
Fully, it's okay, fine. So first of all, thank you very much to all of you for asking me to speak, and especially Dr. Pandya for his kind words, etc. It's a tricky topic because I mean it could end in one slide and say the history of medicine, why bother, don't, or yes, it's important, etc. But I think it's important to motivate people to study the history of medicine for various reasons, which we will go through. And unfortunately, the problem is that students these days would not concentrate on this because of the fact that it probably doesn't have any marks in any of their exams or doesn't contribute to their getting any postgraduate seats, etc. And therefore has less relevance to them. So what I've done is that I've broken this talk up into three parts. First, a little bit of a few theoretical points to ponder. Second, we'll take an episode in the history of medicine and go through it. And the third is we'll see what the lessons from that episode are. I'll just keep a watch on the time and see what's happening. So I'm just going to minimize that. Yeah. So the concept of the history in medicine is that it traces the path to where we have arrived and what were the difficulties involved and overcome. It recognizes the people and the institutions that advance medicine and acts as inspirations to others to also do the same. It points out all the pitfalls and hardships which the brightest minds have had to endure and enhances resilience in one's work when one realizes that everybody else had the same problems and didn't succeed for a long time or didn't succeed at all. And also the difficulties in the evolution of medical sciences with respect to three facets: medical knowledge, medical ethics, and the relationship between medicine and society. As far as medical knowledge is concerned, medical history really teaches you a lot about how nothing which we actually learn or study is actually correct for very long. I know this personally because I started treating patients with HIV just shortly after it had been diagnosed as a viral illness in 1986. And the treatment at that time was acclaimed when we used one drug. Then it was two drugs. Then it became three drugs. And it was emphasized that one had to hit hard and hit early. Then, as people realized that you could wait a bit, we were said, all right, three drugs, but don't treat. Wait for the CD4 count until it dips below 250. Then it was 350. Then it was 500. And then finally it was no, As soon as someone is positive, you treat them immediately. And now the rationale is that you probably treat them at the clinic where they're diagnosed so that they get onto treatment as soon as possible. So as you can see, a huge, huge change, and we don't know where this will go also, hopefully for a cure. But things change very fast. And one has to accept that when you look at the way historically treatments and therapeutics have evolved, that nothing is actually static, and nothing that we hold true now is going to be cast in stone for the future. As far as medical ethics are concerned, ethics should not change, but they do in very subtle manners. And what we had accepted as the style of medicine, the paternalistic manner in which we treated patients and, asked them to obey our prescription, which was take thou, has changed. And the ethical practice of medicine now involves more interactive discussions with patients as to how things should actually be done. And to my surprise, I found that in many societies, retention of organs at the time of post-mortem is also considered unethical and unprofessional if you haven't taken the consent of the relative, something which we all accepted for granted, that we would do a post-mortem, hand the body back for the last rites, etc., but hang on to the other organs inside for further study. But now that would also be considered unethical, and maybe many other things would be considered unethical in the future. The relationship between medicine and society, we will see in many instances, it's basically about healthcare systems, how they're set up, what the demands of society are on people, etc., and how it's actually affecting things. How do I? It won't let me go. Maybe from here. Yeah, so that's the next slide. Can I request the others to mute their mics because I can hear them as well? So to go on to the theoretical considerations, errors in medical practice were accepted as good practice in the past, but now with fresh insights and critical thinking, everything changes. So again, studying history takes you back to understand that what you thought was the best is certainly not that in the future. A value of evidence and assessing the quality of evidence, and then basing medical practice on them as per discussion. Very often, we will see that evidence regarding certain parameters of treatment or certain guidelines that require to be practiced are reviewed by a board of specialists in various disciplines related to the subject, and then ultimately that is given out to the community. We also have to understand how new paradigms are brought about by new technologies. Suddenly you find that everybody is doing multiplex PCR, and we are seeing H1N1 all over the place, or everyone's doing PET scans and we're finding incidental omas, and we have to figure out how to actually treat them, etc. So new technologies can be very powerful, but require careful and accurate clinical interpretation, preferably based on good evidence. Some acceptable ideas and practice have undergone falsification in order to discard older therapies. I was surprised to read some, I think a couple of years ago, about how some accepted practice of some kind of shoulder surgery, which was being done in the UK, was subjected to a double-blind randomized trial in which many of the individuals who had this pain were actually taken to theater and had an incision done, but no operation beyond that, and sutured up and sent back in order to make it as close to the operation as possible. And a huge percentage of people who had had no operation, but just had been made to believe that they'd been taken to theater and had their surgery, actually had felt that they had recovered miraculously. So we have many of these trials which are required to make acceptable ideas and practice undergo a particular kind of falsification in order to discard older therapies, because many of the old treatments have just been passed down from one textbook to the other. The study of the history of medicine also improves the retention of concepts with the benefit of a historical perspective. You hear nice stories, and history has a role in humanizing physicians. Unfortunately, as we become more and more senior in the profession, we tend to feel that we are very exalted, and our patients, of course, make us feel very exalted by thanking us and worshipping us in a sense, etc. But none of us is indispensable. And it has been very rightly said that the graveyards of the world are filled with people who suffered from a disease called indispensabilitis. So, with that, let's move on and let's look at a medical event which took place in Bombay in 1896. So, in August 1896, there was a steamboat called the Mandarin which docked in the Bombay harbor. Now, Bombay basically is a city which is created by the British colonials mainly because of the fact that there was this wonderful harbor over here, probably one of the best in Asia. And if you look a little bit more detail at the map, you'll find that the red bits, which are all the congested bits, are all aligned with the harbor because that's where the shipping and the dock and shipyards were, and everybody wanted to live close to where it was. And one particular area called Manvi over here was the area which had a lot of storage and warehouses for grains and other stuff, which was brought back on ships, etc., and was very, very close to the docks. Now, this is a picture which I had taken of Manvi maybe a few years ago, still very congested, crowded. Of course, all of these buildings are not there from the time that Manvi existed in 1896. And if you look around and see, you'd be surprised to find that there is actually even a Jewish synagogue, which, as you can see over here, it says 245 Samuel Street, Manvi in Mumbai. It's worth exploring some of these old parts of the city. There's a lot of interesting history in them. So in Manvi, there was a practitioner whose statue you can see in the Framji Kaustri Institute, which is opposite the Metro Cinema. And over there, there's a plaque which is also dedicated to him. He is known as Dr. Villegas. And there's a street also named after him, which is just next to Darise Tagyari Lane off JSS Road, which is called Dr. Villegas Street. Dr. Villegas, in August and September, I think, 1896, said that there was cases of bubonic plague which he had seen in Manvi. Now, having bubonic plague in Bombay was something that was feared but hadn't actually happened. There had been an outbreak in Hong Kong and I think in Canton, and people were worried that the Chinese infection would spread here. But the British administrators were very keen to not acknowledge anything of that sort because it would have its own repercussions. The plaque to Dr. Villegas points out that he was the first to detect bubonic plague in the city in 1896, and then he subsequently became president of the Bombay Municipal Corporation for some years. So Dr. Villegas pointed this out. Of course, there was denial by the British doctors who said that there was only a mild fever of a bubonic type, but didn't accept the fact that there was bubonic plague. Of course, the number of cases spread in a couple of months, and the word spread all over town that the plague had hit Bombay, and there was a massive exodus. And you can see this is a drawing from that period of everybody rushing to actually leave the city. So within that, of course, there was a lot of international criticism, and the British powers were very unhappy about that. There were arrival of German and French investigative teams who sanctimoniously set up little tents on what is now Azad Maidan to make their own investigations into what was happening as far as plague was concerned. And they forced the formation of a sanitary conference in Venice, at which the British were berated and told that they were previously the home of the world's biggest cholera hotspot, and now they were in danger of becoming, between Hong Kong and India, the hotspot for the plague. So that was quite embarrassing to them, but they succeeded in preventing there being a shipping or an embargo on the port, which is what they were very worried about because of the commercial considerations of that. And they agreed to set up a plague commission, which would look into everything and publish reports, which was really more of a PR exercise than anything else. It's interesting for me when I read through this period that really the doctors who worked in colonial India were from many varied branches. There were the members of the IMS, or the Indian Medical Service. There was another medical service which was set up out of the parent country, England, which was the Colonial Medical Service. And there were people who were attached to the Medical Corps of the Army, which is the Army Medical Corps. There were private practitioners, there were Vaids and Hakims, and increasingly there were more and more of the Indian doctors who had qualified in the newly formed medical colleges, such as the Grant Medical College, which was founded, I think, in 1845. So all this international criticism upset the British, and therefore they felt they had to do something, or at least show that they were doing something to stamp out the plague. and prevent it from becoming an international incident and having an embargo on their port, etc. Here you can see a photograph of the people of the Bombay Plague Committee, which was set up, I think, in about 1896. And it was meant to be a very firm and harsh disciplinary means of treating this outbreak of infection, because as one of the doctors pointed out, the plague bacillus does not know diplomacy, and it was necessary to use ruthless measures to stamp it out. So you see over here, you have a Brigadier General Gattaker, who was actually over here the head of the committee. You have a surgeon major, you have another major, and you have a couple of the ICS officers, etc. They started off trying to stamp out the plague by trying to track and trace all the infections and isolate people and put them away and segregate them into separate camps. It's interesting that many of these aspects of the control of plague in Bombay have actually been fairly well photographed. And we'll run through a few of them. You can see here somebody inspecting someone for plague at Science Station. Here you have a picture of temperature taking for the plague in Bombay. And here you can see that in a house from which there were victims of the plague, their clothes have been brought out into the street, and that's their charpoy also. And all of it was burnt publicly as a means of kind of disinfection. And you can see over here the memsabs with their parasols and their hats looking on at this sanitizing measure which was actually taking place. These, of course, caused a lot of resentment. People hated the idea of having to be thrown out of their homes and their homes being turned upside down. In many instances, the roofs were taken off because it was felt that it was necessary to create more ventilation, or the earth was dug up because, according to some of the theories of the IMS officers, the plague bacilli actually lived in the ground. Women were often stripped to inspect them for the presence of buboes. Men were also asked to take off their clothes, and it caused great offense to the population of Bombay. You can see some of the ridiculous aspects of it, which have actually been captured in a photograph from Karachi, where somebody's sitting in a wooden tub and they're disinfecting people through this hose pipe. What sort of disinfectant they used, I'm not sure. And how to disinfect people who actually wear all their clothes on is also difficult. These are some pictures they've taken of the segregation camps. This is a well-to-do family that must have had a nice home in Bombay, who were removed. The gentleman is lying on a carpet, and these are the accommodations that they've been given. And they don't look very happy, even though they're all dressed up for this photograph. On the other hand, as far as the poor classes were concerned, they were removed and put in these little hutments, which were all over the place. And you can see that they were prevented from leaving by the fact that there were all these guards and sepoys and police officers around to make sure that they actually stayed where they were. These were temporary hospitals. You can see over here, these are these sort of crackling bamboo chicks which have been put up with observation charts. Over here, a lot of English nurses and people actually came from England to nurse these patients out of a sort of a missionary spirit that actually took place. And there were many, many temporary hospitals that were put up for the plague victims. And interestingly, you find that the hospitals also had a certain form of segregation. The Hindus would not want to go to a hospital where certain types of food were served. They didn't want to go to a hospital which was not for people of the same caste that they came from. The Muslims wanted their own hospitals. There were Maratha hospitals, Parsi hospitals, and all used for segregation of patients who were removed from their homes because of the plague. This is one of the most telling pictures from that time, which shows the gathering of an inspection and sanitization party for the plague. Let's look at it a little carefully. Here you have the white Saab in his white outfit with his cap and a stick in his hand. Here you see the interesting Indian collaborators with the Muslim cap, Hindu cap, a Parsi couple of caps, the ladies over here, again, one of the police officers over here, others all on the side, sepoys at the back to enforce discipline. And this interesting structure on wheels, I'm not sure exactly what it is, whether it's a hearse to carry away bodies or it was meant for the ladies to come in parda and to the areas that they came to, etc. If you look a little beyond, you can actually see that over here there's a little machine with a little steam engine over there on wheels, which was what was used to spray carbolic acid all over these structures. I'm not sure exactly where this picture was taken, but there are very similar high walls which are present just outside the Umar Khadi Children's Remand Home, which is in Dongri, and that was previously the town jail. Here's a photograph not well taken showing plague search party in the Muslim quarter in Bombay, and you can see some minarets and a mosque which is over here. And this is the machine in operation. The White Sahib is actually displaying, pointing to where he wants his carbolic acid sprayed, and people have been moved out and the whole thing has been made wet. What this actually achieved, nobody knows. Was there any data taken to show that it helped in preventing outbreaks of plague in nearby houses or actually helped people to recover? No. It was just symbolic, but it was done with great belief and force among members of the Indian Medical Service who believed in what was called the miasmatic theory of transmission of disease. And that bubonic plague, according to them, was not really or was very mildly contagious or infectious, and the infection actually came from the atmosphere and the ground. In the same area, you can see that in order to enforce the measures that were present, you have a contingent of the troops of the army that was stationed in Bombay at that time. Sadly, you can see over here that houses were marked according to how many of people had died. So each of the circles represents a case of the plague in this block of houses. And once there's a cross within it, it means that actually somebody has died. So you have so many cases and you have so many deaths which were present over there. If you look a little beyond this photograph, you see that the normally busy streets of Bombay are completely deserted. And even though this aspect is blurred, it looks as if this is the contents of the home or homes of one particular family that has been forced to evacuate their house and move into one of the segregation camps. Again, you can see in Girgam, the plague rings on an infected house, showing the number of people who are infected and the number of deaths that took place. Churney Road Hospital, another one which is just set up, so many temporary hospitals. This is the one which is the Kasturba Hospital, or the Arthur Road Plague. It was before it was known as the Kasturba Hospital, it was known as the Arthur Road Plague Hospital. This is what it was like when I actually worked there. And these are some of the photographs that I have from old pictures. And this was the disused morgue within the grounds of the Kasturba Hospital, which was used at that time when plague patients were actually admitted. I've included this picture of the staff of the hospital at that time to show the medical students who are attending this lecture that how fortunate that they are that they can dress in a much more casual and loose manner than their colleagues historically dressed in the past. And it may be that everybody had dressed up because a formal picture was taken. But when I spoke to Dr. Naushad Wadia, who founded neurology at the JJ Hospital, interviewed him, he said that they always wore jackets. And I asked, but how? He said that the weather and the climate in Bombay, according to him, was completely different. And they just had 2 bad months in May and October. And the rest of it was wonderful. But I think also what I wanted to tell the medical students is that people dress formally and dress a little smartly, not because they want to look good, but also because it is a sign of respect to the patients and to the profession that you are serving, that you feel that it's worth dressing up for that reason, which is the same reason that I have worn a tie, even though I'm sitting comfortably in my own home today, as a mark of respect to the authorities that have organized this lecture. So hopefully we'll see our medical students dressing very smartly from now on as they realize this. This is a map of Bombay. Unfortunately, I can't enlarge it to show you the details, but it's dotted with pictures of segregation camps and hospitals which are associated with the plague, which is what the focus of the city was around in the late 1890s and 1900s, because they had lost completely the labor force of the city, and the economic output of the city, which in those years was in the form of mills and dock workers, had completely collapsed because there was no labor. You can see over here some of the statistics which have been calculated, and by 1903, the plague deaths in Bombay were almost at the rate of 500 a week, which was very bad. So from 1896 to 1903, with all these methods, nothing was actually achieved. And what actually happened also was that riots broke out because people were very offended by the measures that were taken. And the person who was in charge of the plague committee in Pune, an ICS officer called Rand, and his assistant were assassinated in a planned manner by the Chafika brothers in Pune, which then made the British a little bit nervous, and they backed off because they didn't want to risk another 1857 mutiny on their hands. And so they continued with these methods of segregation, isolation, carbolic acid spraying, etc., to pacify the European powers that things were being done and there was no need for an embargo on the port or passengers. But we are talking about a time in 1896 when not even a decade or two had passed before bacteria had been identified under the microscope. And already we're looking at the fact that vaccination could be a strategy. And this, of course, fell into the hands of Hafkin, whom we know of in this country and especially in this city, but many people all over the world have hardly ever heard his name. He was basically a Russian from Odessa, and he trained partly there and partly in Paris in the Pasteur Institute under Mechnikov, and developed what he thought was a two-stage cholera vaccine. And in order to test its efficacy, he requested the British government to let him come to India and test it out. But unfortunately, there were no outbreaks of cholera when he came here. So he went off to the tea gardens of Assam to try it there when he heard about the plague in Bombay and volunteered his services. And within a few days, he was on a train traveling to Bombay and was given a space in the Grant Medical College in order to work on plague research. He identified the infection as being plague. Here's a picture of our JJ hospital. That's one of the rooms in the building in where he actually worked. And you can see this beautiful old door from that period where which Hafkin must have walked through. And let's take a minute to pay our respect to him by reading the plaque, which was unveiled by the President of India, V.V. Giri, in honor of the memory and work of Waldemar Mordechai Hafkin, born in Odessa, Russia, on March 15, 1860, died in Switzerland, October 25th, 1930. He gave 22 years of his life to India in this building, into brackets room 000. He created the very first successful vaccine against bubonic plague, with which he first injected himself. He saved millions of lives in India during the cholera and bubonic plague epidemics that swept across India and throughout the world. Pioneer in public health, human benefactor of mankind, he was a true citizen of the world. Waldemar Mordechai Hafkin International Memorial Committee in 1973. So that plaque, as you can see, it was in a messy condition when I actually took this picture, and people really haven't given him much credit for what he did. But he developed the vaccine, he injected himself, he found he didn't get much of a reaction. Then he had an opportunity to test it out when there was an outbreak of plague in a bicolor prison, where he divided the population into two halves and found that those who had been injected with the vaccine had a much lower rate of mortality, and convinced the British government to let him try vaccinating the population. This wasn't taken well by the posh and pompous doctors of the Indian Medical Service, who tried to discredit his vaccine and said it wasn't successful, etc. And interestingly, there was a lot of reaction against his vaccine being prepared in broth to grow the bacteria, because it was felt that the use of porcine pig's broth would offend the Muslims, and buffalo or cow broth would affect the Hindus. So ultimately, it was goat's broth that was used in order to grow the bacteria, in order not to offend any of the population. So here you have Hafkin again dressed up in a suit in the hot weather. I don't know how they managed injecting someone with the vaccine, and vaccination spread to the extent at which there were even postcards being sent all over the world of inoculation against the plague in Bombay, which was derived from this photograph. Over here, again, you have seen someone being injected, but I'm not sure whether this is a vaccine or it is actually the aspiration of a bubo in the inguinal region over here. So he seems to be pushing something in through this rubber tubing, which is attached to this rather old-looking glass syringe over here. Lovely old pictures. Anyway, the long and the short of it was that Hafkin had his supporters and his detractors, But when there was a
मुझे
huge
पता नहीं
outbreak
था,
of
मेरे को एक टीचर ने
plague in
हमें
the
बताया तो
Punjab,
मेरे को ऐसे रियलाइज हुआ
governor of the
उनके टाइम पे
Punjab,
ग्लास सिरिंज होती थी तो
can
वो
we ask everyone to mute, please?
हम तो
Yeah.
प्लास्टिक की यूज करते हैं ना सब नीचे गिरी टूट गई
So
और वो
the Lieutenant
जो ये
Governor of
वो
the
भी जाते
Punjab
ब्लड
actually
सैंपल वो भी
requested
ग्लास के
Hafkin
बॉटल्स में
to
लेके जाते
scale up the inoculation
तो हम तो ऐसे
and
लेके जाते
inoculate
जाते हैं उन
many
कितने
more
वेस्ट हो
people.
जाते होंगे सैंपल और उनके वो उस टाइम पे वो ईडीटीए वगैरह इतना नहीं होता था तो फटाफट वो लोग फोन लेके जाते थे कभी के कभी करवाते
Rahul, can we ask them to mute?
होता था मेरे को याद है वो
Okay.
जहाँ भी जाते थे ना तो
Yes, I
Try.
understand.
पतीला टाइप पड़ा होता था तो वो ग्लास के सिरिंज उसमें
I
डाल
can take a little break for 5 minutes before we do the second one. Yeah, okay.
अभी तो रीयूज नहीं करते ना
No? So anyway, so basically what happened was that
Hello?
Hafkin was told that you really need to up the production of the vaccine. And so what was essentially his laboratory was then turned into a factory, and he was given the governor's mansion in Parel, which is now the Hafkin Institute, which was originally a Jesuit seminary, which was used for the training of Jesuit priests. Then after the Portuguese were expelled from the lands of Bombay, it fell into British hands, and it was used along with extensive gardens around it as the governor's residence. But then I think one of the governor's wives, I can't remember what her name was exactly, she died of cholera when she was living there. So the British got nervous and then evacuated from here to their current residence of the governor's house, which is now the Raj Bhavan at Malabar Hill or Malabar Point, it was called. And therefore, this was turned into the laboratory for Hapkin, which is the Parelic Enteric Depot. If you go through, you'll see a plaque which is actually present, which recounts the history of that building. And you can see some of the grand staircases from the time when it was the governor's mansion, which are still existing in what is now the Hafkin Institute. Of course, this rapidly became a laboratory and a factory for producing vaccine. You have everybody fiddling around here, doing things, etc. And I think almost 500,000 people were inoculated with Hafkin's vaccine over a period of many years in the Punjab. Unfortunately, everything went wrong when there was an incident in what is a little village in the Punjab called Malkowal in, I think, October 1902, where 17 people who were inoculated with Hafkin's vaccine actually died of tetanus. And there was a huge uproar. There was an investigation. One of the most promising judges of the Bombay High Court, Lawrence Jenkins, was asked to investigate. And of course, the government or the British government tried to firmly blame Hafkin for the responsibility for having spread tetanus, because in order to speed up the production of the vaccine, he had tweaked the manufacturing process and left out some amount of phenol which would have killed off tetanus spores. Hafkin himself originally believed that there was a problem in the manufacture of the bottle from which the patients had got tetanus. But it soon became clear that what had happened is one of the Indian assistants had picked up a forceps which had been dropped to the ground and used it to open the bottle. And in that process, he had actually contaminated the bottle with tetanus spores. It was postulated that if tetanus spores were present within that bottle at the time of manufacture, it would have resulted in putrefaction, and there would have been a strong smell when the bottle was opened. And every bottle, when it was opened, was smelled to see if there was any putrefaction. Also, the process which the Indian assistant used to clean the forceps which had fallen to the ground by swishing it in a phenol bath was not considered inadequate, and they were actually supposed to be passed through a spirit lamp. But the process conformed to the manual which actually was present in the Punjab plague manual or whatever, and therefore this caused a huge uproar. Hafkin was blamed. Hafkin was sent on leave and told to go away and do no work. And for 3 years, he was without a job, without any pay, and running around trying to salvage his reputation. Interestingly, at that time, the understanding that plague was transmitted by the bite of an infected flea which had picked up a blood meal from the rat had not been discovered. And work on it was going on because it was already found that many parasites were transmitted through insects and arthropods, etc. But what I found fascinating was that Hafkin refused to accept this and tried to stamp out the research that was being done in his laboratory to actually establish this, to the extent of having the equipment of his assistant who was working on this theory completely dismantled, someone called Simmons. And so that theory didn't come up till later. And when it did, there was a sort of a massive attempt to get rid of rats, and the British offered a certain amount of money for every rat tail that was actually brought to them, and compensated people for that to try and get rid of the rats, because now it was felt that more than anything else, this was what would cause the plague to die out. We don't know exactly why the plague died out. It killed about 10 million people all over India in the next 10, 15 years. But it's postulated that the rats ultimately became immune to the plague bacteria, and that may be the cause for what actually happened. As far as Hafkin is concerned, he had a sad ending. His achievements were not really celebrated. He went to England and explained his position to Ronald Ross, who at that time was about to get the Nobel Prize for his discovery of the transmission of malaria through mosquitoes. And Ross and one of his assistants wrote strong letters to the newspapers and got the scientific community to support Hafkin. And the British government reluctantly let Hafkin return to India and gave him a small laboratory to work on in Calcutta, but didn't give him any responsibility, and practically ignored him until he retired and left and went back to Switzerland, where he lived a quiet life and died. He was not even aware that the institute which he had worked at and manufactured the plague vaccine had been named in his honor as the Hafkin Institute until he came across it in the newspapers. Nobody reached out to him to discuss it with him or ask him to come for the inauguration or whatever. So quite a sad ending. So what were the lessons that this historical episode actually taught us? That first of all, that you can't advance science if you have a lot of prejudice. There was a huge amount of prejudice against Dr. Viegas. In fact, the British official papers insist on referring to him as Mr. Viegas. They didn't even give him the status of a doctor. And because of the fact that Viegas said that there's plague and they didn't want to agree, there was a big hiatus and time lost in actually getting things going and doing things to actually prevent the spread from the community, by which time it had caught hold in the area and people had fled. There was a huge amount of prejudice against Hafkin for many reasons. He was a Russian, and the British felt that the Russian were trying to play the great game and invade Afghanistan and come onto the frontiers of the British Empire, and he might have been a spy. He was Jewish, that was resented. He was practically the only bacteriologist who had excellent training, who was in India at that time. So again, that was resented by the pompous doctors of the Indian medical service at that time. There were vested interests which prevented people from doing the right thing. They were commercial. They wanted everybody to continue working. They didn't want profits to suffer, etc. They were professional. The IMS doctors didn't like the colonial medical service doctors, who didn't like the army medical service doctors. And the Viceroy, Lord Curzon, actually commented that he had seen nothing more odious than the jealousy of doctors in the medical profession among each other. In the beginning, when the miasmatic theory was being formed and segregation and isolation was being done, there was this frantic activity without any plan or accumulation of data. There was no respect for cultural and religious sensibilities. There was riots and assassination. And actually, nationalism was stoked by brutal methods of control. And Tilak wrote a huge number of articles against the drastic measures and the invasive measures which were taking place on account of the plague, as a result of which he was prosecuted for sedition. And this may have, in fact, sparked the nationalist movement to a certain extent. So you can see that medical history has such a strong role to play in the independence of our country as well. Vaccination was also derailed by bad luck, as in the Malkowal incident, by rumor mongering. At that time, the statue of Queen Victoria had been painted with black tar, and the government was upset about it. And many of the simple people in the city thought that the plague was revenge for what they had done. There were rumors that the patients who were being taken to the plague hospitals had their hearts being cut out and were being sent to Queen Victoria in London. Others felt that the vaccine contained the serum of lower caste people that was being injected into them, etc. So there's enormous rumors and prejudice which was there. And interestingly, as I'll point out to you, that this epidemic actually changed the face of Bombay. I think we've got another 5 or 10 minutes. So you can see over here that there's very little to remind us of the plague in the city of Bombay, an epidemic which killed tens of thousands of people every year was something that we would consider. But you have these little crosses on the wayside which have been put up in remembrance of deliverance from the plague, much as they were in many parts of Europe in the medieval ages. There's a bust of Hafkin, which is the only one I've seen, which is present in the Hafkin Institute. But more than anything else, what happened was that the actual face of the city changed because the government was so upset with the negative criticism that they had received because of the plague that they changed the nature of the city planning. The Bombay Municipal Corporation, whose lovely building you can see here, consisted of an elected body, many of whom were complete nationalists and criticized the British government. And so the British government actually took away power from the BMC and vested in a new body they formed called the City Improvement Trust. And this building is now the ENT hospital. You can see the statue of Queen Victoria, which is over there, which is now where the VSNL building is, just next to Flora Fountain. So the City Improvement Trust was formed directly as a response to the overcrowding and the messy accommodation that was present in the Indian sections of the city around the time of the plague. And it bypassed the BMC completely. It gave them vast powers. It transferred all the empty lands of the municipal corporation to the CIT. And thanks to the planned schemes, there were about 30 or 35 schemes which the CIT created. You have the whole Worli Seaface development. You had the Cuff Parade development. You had the whole laying out of Agripada. Princess Street was created in order to allow fresh air from the sea to enter into what was called the native town. And Muhammad Ali Road was created as well in order to open up areas of the town. Many of the streets and schemes were created by the City Improvement Trust. And none of this would have taken place if it wasn't for the fact that that one little steamship, the Mandarin, docked in Bombay in 1896 and actually gave us the plague, which created all this mess. As far as COVID is concerned, when we compare it with our responses to the plague, what did we learn from the history? There was the same panic that happens always when we have something new which we don't understand. There was irrational segregation initially before home quarantine actually became valid, and there was the adoption of all kinds of bizarre therapeutics, drugs which had no role to play. Some of the prescriptions are absolutely hideous, with 5 and 10 different drugs being prescribed, modern expensive biologics, high frequency nasal oxygen. And it's only in certain advanced societies like the UK where they would hold off panic medicine and actually allow a trial to take place, despite the fact that people may say that, some people will die until you get the results of that trial. And the results which came from the UK recovery trial very rapidly showed that steroids were of definite benefit in patients who had lung involvement when given at a certain stage, and discounted the value of half a dozen other things which were being prescribed and causing toxicity. We've had vaccine deniers. We had vaccine deniers in the form of the IMS during the plague epidemic. We have vaccine deniers even now all over the world, even in the advanced countries. And we've had damage to the economy from overcaution and over lockdowning as well. So interesting to compare responses to COVID with responses to the plague at that time. And my last slide, I'd just like to go back and point out that history helps to decipher the landscape in which we are living. Not just in medical terms, but I mean, in a city like Bombay, you can even say that many of the streets and the sort of vistas that we have are partly because of the history of the medical occurrences of our previous times. It helps us to know ourselves better by understanding the contrasts and similarities that have occurred over time. And I'll end with this quote, which I'm going to read out, which I got from the BMJ, that it has been said countless times by hundreds of physicians since the time that Cicero, who was a great Roman philosopher, argued centuries ago that the truly outstanding physicians are also historians. It is time that bioethics programs around the world recognize that much of the time devoted to bioethics training should in fact be medical history, and that it is our responsibility as bioethics scholars to impress this fact upon deans of medicine in a timely way, lest the medical students of the first decade of the 21st century continue to be trained in the main as technicians with a human touch, who are utterly unable to cope with a changing world because they lack roots in the history of their profession. So with that quote, I will end. Thank you very much for having been a patient audience.
Thank you so much, sir. So, thank you so much for a truly fascinating lecture. It was extremely interesting to learn about the history of the bubonic plague in Mumbai, and the pictures that you displayed were amazing. It was delightful to see how the landscapes changed in many areas of Mumbai even today, which we see even today. And the message at the end about technicians with a human touch is, I think, something all medical students like me should learn and try to inculcate. I would also like to give thanks to our Dean, Professor Dr. Sangeeta Rawat, for all her encouragement and support towards the Division of Medical Humanities. We are tremendously grateful, of course, Dr. Jehangir Sorabjee for accepting our invitation and for delivering this fantastic lecture on the importance of studying history. This lecture series would not have been possible without the guidance of Dr. Pandya sir and Dr. Lopa Mehta ma'am, and we are extremely thankful to them for all of their help and guidance. Lastly, but not the least, thank you to the audience, my peers, all the faculty members, senior teachers and doctors who have joined us today. We are truly overwhelmed by your response, and I look forward to meeting all of you all next week and in the coming sessions to come. On that note, next week we have a lecture on pioneers in medicine, all the amazing men and women who conducted research and came up with